And hello again, good afternoon, good evening, or maybe good morning for those joining us from our Americas. This is the wrap up of the 4th Digital Health Society Summit. We had 2 days full of action, discussion, sharing, and exploring the different solutions, data and digital solutions that help the recovery of the health systems. We had, I think, 17 hours of the program, so a lot of different sessions going through the European health data spaces, city data, vaccination registers, and so on. So it was a bit difficult to pick up 2 or 3 key messages, and at the same time it was quite simple, as we heard all over again the call to action for collaboration, for connecting the dots, for breaking the silos, for working together, for systems approach. So generally, we heard the call to action for like whole of government, whole of society, including different stakeholders. We also heard, of course, that a lot of data is currently fragmented, and people still, despite all the efforts, work in silos. But I think that the key message is that this cannot go this way. This is something of the past, and it's definitely not sustainable. So I will encourage us to assume this responsibility and don't wait for the invitation to collaboration, but start collaboration in the first place. And of course, again, if you're looking for collaboration partners, the ECH Alliance is your first place to go, and we are always happy to facilitate this kind of collaboration. And maybe my other key message would be this message of the need for trust. I think we've heard about trust so many times that sometimes we are like thinking like, oh my trust, how many times we can raise this issue, but apparently it's a key to everything. If we think about the quality of data, about, of course, volume of data, about the proper implementation, about the systems that work and the solutions that work, we need to ensure that people that we build those solutions for and those policies for are comfortable with those solutions and those policies, and they also are able to use it, and they trust that they're ethical, that they're built according to the standard, that they're built according to based on the good quality data. So I will also encourage us all to really think like from the very, very beginning, from the very first survey that we might do to create our policies or our solution, to think about this already at that stage. And with this, I would like to ask my co-host, Bledan Rees, who is the chair of the Digital Health Society that organized the summit, for his key messages from those 2 days.
Yeah, so for me, I'm going to just focus on today. And on the European health data space, we had a great vision from Johnson & Johnson of what it could look like. And then the panel itself really emphasizing that there is universal support for the idea of a European health data space. But actually, this trust that you refer to is only going to happen if all stakeholders can together collaborate to make it happen, so that there's a job for all of us to get involved and not just criticize from the sidelines, if you like. Also, that member states have a big job to do to try and work out what it actually means for them and how they're going to adapt to the European health data space. So to some extent, there's a need for patience from us as member states go through that process. There was some skepticism about the self-certification of health apps. The Smart Cities session was very interesting about how you create the right collaborations between the academics, the local authorities, the the organizations that are either procuring or deciding policy to make those smart cities work. I really liked Anne from ATA saying that telehealth is health. I liked Rachel's descriptions of the iceberg of AI, and that AI is like a junior nurse or doctor and it needs supervision. I also like that AI is about increasing intelligence and that we don't really have self-learning AI operating now. So that's just a very quick whistle-stop tour of what gripped me today.
Thank you so much, Vladimir, for sharing those thoughts. And yeah, we had fascinating 2 days, and the next Digital Health Society Summit is next year. I assume that will be the 5th edition, so celebratory edition. But if you who are watching us think where to and when you can meet us in person or online, we don't leave you for the next 12 months waiting for that occasion. There is a number of the networking and connecting the dots event that ECH Alliance, together with their international global partners, organizes. There is already soon, still in October, the event in New Delhi at the Global Digital Health Summit and Awards. There is also an event in the USA in November at Health. Also in November in Nairobi, Kenya, we will meet for the Global Health Connector Partnership Summit at Africa Health Business Symposium. Then not long before Christmas at the ATA's Edge Policy Conference in Washington, DC, and back to Europe in February, the end of February, for the Digital Health and Wellness Summit at the Mobile World Congress in Barcelona. And then still in spring in Nashville, in USA, we will be at ViVE. So there is a lot of different opportunities for all our stakeholders from around the world to connect with us, to be with us, to be part of this incredible ecosystem, digital health ecosystem around the world. And if you also want to showcase with us during the Health in Las Vegas, you have the opportunity to be part of the ECH Alliance Global Health Pavilion. And if you're interested in this opportunity, please connect with my colleague Beatrice at echalliance.com for more details. I know that we have at least one space still available there. So opportunities and to connect, to meet us, to discuss, but events or not, we're always there at echalliance.com, on social media, on LinkedIn and Twitter, and very happy to always respond to your emails and calls. So don't hesitate to connect with us. And on behalf of myself and Vladimir, has been my co-host for those 2 days, thank you so much for being part of the 4th Digital Health Society Summit. Over 970 registrants from 95 countries. Of course, I will say this was the record-breaking events, and the final word goes to Vladimir.
Carolina, thank you. And I'm just going to take this opportunity just to say a huge thank you to the ECH Alliance team behind the scenes who have made the summit possible, who have worked for many months planning this, and for the last 3 days have had intensive days as we organize this. Strangely, it feels to both Carolina and I that it's sometimes harder to actually organize a virtual event than it would be if this was a physical event. But thank you to all for being there, and I look forward to seeing you next year. Thank you.